first, I just want to start with what men need to know about prostate cancer. What puts them at risk of developing prostate cancer?
Prostate cancer is in some ways ubiquitous. 1 in 6 men will be diagnosed with prostate cancer. It is still the most common cause of cancer-related death in men, among those who are non-smokers. So it is an important issue. What puts people at risk of prostate cancer? Age, number one. Usually the sweet spot for prostate cancer is age 55 to 69. Race, African Americans tend to have a 2x higher incidence of prostate cancer. And of course, family history. That's not just of prostate cancer, but it's of all adenocarcinomas, other examples being ovarian, pancreatic, breast. So those are the big 3 risk factors: age, race, and family history. But prostate cancer can occur spontaneously, so it is very important for men to be screened.
A lot of those risk factors, obviously things men can't really control, but are there ways to reduce their risk? You mentioned the importance of screening, so talk a little bit about that.
Usually patients, when they become of age, and what I mean by that is between the ages of 55 and 69, we're actively screening. The way we do that is with a PSA test, which is a blood test, as well as a digital rectal exam. Between those 2 screening modalities, we tend to pick up most clinically significant prostate cancers. Those who have high risk, African American, family history of adenocarcinoma or prostate cancer, we tend to screen those patients a little earlier. So according to AUA guidelines, no one under the age of 40 should be screened for prostate cancer. But when you get to that age between 40 and 55, if you have risk factors, a baseline PSA is recommended.
For someone that is diagnosed with prostate cancer, what does treatment look like for them?
Sure. So treatment of prostate cancer really depends on what the tissue samples show us. So again, we are not as concerned present day with low risk prostate cancer. So a lot of times with people with low risk prostate cancer, we'll do active surveillance. And active surveillance is we're monitoring the cancer, but we're not necessarily treating the cancer. Because we've shown that over treatment of low risk cancer does not move the needle in regards to life expectancy. But with intermediate or high risk disease, this again is where we as urologists can really impact the patient's overall survival from that cancer. So in terms of treatment for intermediate or high risk prostate cancer, usually per NCCN guidelines, that would vary between either radiation, where we deliver external high beam radiation to the prostate itself to destroy the cancer, or surgery, which is what we do as urologists, and involves removing the prostate. It is essentially a curable disease if found early enough.